Hello everyone, I am Dr. Mohal Banker from Banker's Vascular Hospital. I am Interventional Radiologist, and today we are going to discuss one interesting case of frozen shoulder. Frozen shoulder is relatively common in our society. Most commonly the diabetic patients are suffer with this frozen shoulder, and there are three phases of the frozen shoulder. One is freezing phase, that means the painful restriction of the movement. Whenever the patient do any kind of movement like lifting arm or just internal rotation or external rotation, whatever the movement, patient is not able to do, and whenever the patient do that particular movement, he feels the pain. The second phase, the pain will reduce but the restriction of the movement will continue, and in third phase there may be some recovery of this into this restriction of the movement. So there are three phases of the frozen shoulder, and sometimes each phase lasts for more than 6 months to 3 years. So relatively many times when we observe in our OPD, the patient are suffering from frozen shoulder since last 5 years, 6 years, maybe some patients are for 9 to 10 years. So this is a very chronic disease. So why the frozen shoulder developed? So our shoulder joint is very different joint. It has a ball and socket type of joint, but because the shoulder joint is designed for the multiple range of movement, 360 degree of movement, there is a thin capsule cover which is given to the shoulder joint, and when this capsular cover is inflamed and thick, there is no space left, and that's why the restriction of the movement will start. So the ideal treatment is a physiotherapy. Physiotherapy works wonderfully in the frozen shoulder, but if the physiotherapy fails, then what's the next? So for that, in Banker's Vascular Centre, we are doing the transarterial microembolization. That is called frozen shoulder embolization. And in this transarterial microembolization, we do the angiography of the shoulder joint. So angiography of the shoulder joint, we cannulate the blood vessels which is supplying the blood to these around the shoulder joint, and during the angiography we find out the abnormal moya blood vessels which is releasing the cytokines, and these cytokines are the responsible for the thickening of the capsule and the cartilage, and that's why the patients develop the frozen shoulder. So you can see over here in this angiography, there is a blackening area. This is called abnormal vascularity. In Japanese language, this is called moya blood vessels. So in angiography, we are able to find it out. These moya blood vessels in the suprascapular artery. Once we find it out, we inject this small embolizing particle. These particles are actually destroying these moya blood vessels, and by destroying the moya blood vessels, it stops the release of the cytokines within this capsular area, and that's why the inflammation stop, and when the inflammation stop, again the recovery will start. These are totally non-surgical treatment. Angiography is done with the radial puncture, just like if you have encountered in your family anybody has gone for the cardiac angiography. Similarly, the same way cardiac angiography also done with the radial puncture, and shoulder angiography also done with the radial puncture. This half an hour procedure, and patient will resume day-to-day work within a few hours. And these are very rewarding procedures. This is called transarterial microembolization, and we have treated lots of cases with this technique, and it is really working wonderfully. Whenever the patients have frozen shoulder along with some tendon tear, then the response may vary, because in this technique we stop the inflammation or swelling, but we cannot replace the damaged tendon, and that's why sometimes response vary if this patient present with rotator cuff tear or any tendon or muscles is affected. So hope you understand this topic very well. If you have any kind of question, query, do ask me. I would be very happy to give you answer. Thank you.